These are the stretches that can help with hip and back pain. You would need a belt for this, and you'd mostly be on the table or on the bed. You could do this on the bed as well. So first one is a hamstring stretch. You can hook the belt or a bath towel onto your foot. Raise your leg up like that. Try to relax as much as you can and hold this stretch for 30 seconds or a minute. A minute would be good, and do it 3 times. The next stretch is the TFL or IT band stretch. Again, you'll be on your back. Hook the belt onto your foot. Straighten out your leg like that and bring it towards the middle, towards the midline. Hold that for 1 minute and you do it 3 times. The next stretch is a quadriceps stretch. You're going to be on your tummy, face down, and all you're doing is bending your knee. Bring your heels towards your buttocks, and you should feel the stretch in the front of your thigh. Hold this for 1 minute and do it 3 times. These are strengthening exercises that can help with hip and back pain. The first one is the bridges. You're going to be on your back with your knees bent and feet flat on the bed. Bring your feet hip width apart. Squeeze your buttocks as you lift and hold it here for 5 seconds. Come down. That's 1 repetition. I want you to do it 10 times. The next exercise is a supine clam exercise. This one you're going to use an exercise band. It can be any color, but preferably green. If you want to buy one, we're going to put a link on the video below. Tie it around your knees. Make it snug, and then lay on your back. Feet flat, hip width apart. You're going to stretch the band and hold that stretch for 5 seconds and relax. Do this 20 times. The next exercise is a side clam. You're going to be on your side, still with the band around your knees. Feet together and feet in line with your buttocks. And then keeping your feet together, you're just going to lift the top knee like so. Hold it for 5 seconds. 1, 2, 3, 4, 5. Down. That's 1. Again, lift, keeping your feet together. Hold that for 5. 1, 2, 3, 4, 5. That's 2. You're doing it 10 times on each side. Now the next exercise, we call it a Multifidus Supine. So let me take off the band. And this time you're going to use a rolled towel. Put it under your ankle and you'll be on your back. Keeping your knees straight, you're going to push the towel down with your ankle and hold that pressure right there for 5 seconds and relax. You're going to do it 20 times on each side. So 5 seconds, push down towards the table and relax. Now you're going to do it 5 seconds, hold 20 times on each side. The next exercise, we won't be needing this towel. You're still going to be on your back. We call it the bent knee fall out. One leg straight and the other leg's bent. So you're going to make sure you have your abdominals tight, or you bring your belly button towards your spine. And then in a controlled manner, drop the knee out to the side as far as you can, keeping your abdominals tight. As far as you can. And then bring it back to the center slowly in a controlled manner. So you're doing it 10 times on each side. The other exercise would be Supine Marches. Again, you're going to be on your back, Keeping your abdominals tight. You're going to march in place, lifting your feet about 1 to 2 inches off the table. Keeping your abdominals tight all the time as you do this exercise. Every time you lift your right knee, that's going to be 1 repetition, and you're doing it 20 repetitions. Keeping your abdominals tight all the time. Make sure you're breathing. And the last exercise is a prone hip rotation. You will be on your tummy. Bend one knee. Tighten your abdominals as you do this, and do not arch your back. Tightening your abdominals or bringing your belly button towards your spine will help protect your back. And all you're doing is rotating, bringing the leg in and out, like so, slowly in a controlled manner. Every time the leg goes out, that's 1 repetition, and you're doing it 20 times on each side. Hi, today I am showing you self-release techniques that I use for clients that have hip, knee, and back pain. I would like for you to take note of each of the positions. You need to hold each of these positions for 5 minutes. Make sure you are relaxed. You're breathing in and out to make sure that your body is relaxed as you do this release technique. Okay, the first one is a lower trunk rotation. You are going to be on your back, feet flat, hands onto your tummy, and you're just going to rotate your lower trunk to the side, making sure to keep your shoulders flat on the table. Again, you're going to hold this position for 5 minutes. While you're here, close your eyes, breathe in and out through the tightness, and keep stretching all the way down as far as you can. 5 minutes waiting for your fascia to relax. Once you're done here, you're going to do the same thing on the other side. Again, holding this position for 5 minutes, breathing in and out to relax the fascia, keeping your shoulders flat on the table. The next release technique is what I call a leg hang. You're going to be laying on your bed diagonally. One leg is bent, and the other leg is off the table or off the bed. You're going to let your leg hang from the table. Bend the knee a little bit and telescope this leg all the way down. Again, you're going to hold this position for 5 minutes. Do not arch your back. Just try to relax. Hold this position for 5 minutes, breathing in and out as you remain in this position. You're going to do the same thing on the other leg. The next release technique is what I call a hip and an upper back release technique. You're going to be on your back, both legs straight initially. I'm going to come down so I won't hit the wall. And then I'm going to cross the right leg over the left leg. And then I'm going to raise the right arm up. And I'm going to stay in this position for 5 minutes. Breathing in and out, trying to relax my body so my fascia will release. Hold this position, try to relax and breathe for 5 minutes. Once I'm done here, I'm going to do the same thing on the other side, straightening the leg, crossing the left leg over the right, keeping my shoulders flat on the table, and just lifting and raising my left upper extremity. Again, hold this position for 5 minutes, breathing in and out. The other release technique is sitting, leaning, having your legs straight and leaning forward like so. You can hold on to the table for stability. You're not rounding your back, you're hinging from the hips and trying to telescope your legs out towards the front. Again, breathing in and out and maintaining this position for 5 minutes, allowing your leg and your back to relax. I'm going to keep hinging as I keep releasing. 5 minutes, breathing in and out. Here are some foot and leg release techniques that I also use for my clients with hip pain, back pain, or knee pain. So first is you're going to be leaning on the wall with your elbows. Bring one foot back and lean forward. You will be releasing the back leg. You're going to hold this position for 5 minutes, breathing in and out as you wait for the release. Try to relax as much as you can. Bring your shoulders down and relax. Lean against your elbow. Lunge forward to increase the stretch and hold this position for 5 minutes. The next technique is a foot release. All you're doing is turning your foot out like that because you're releasing the front of the foot. Okay. Again, lean on the elbow and just hold that position for 5 minutes. You should feel a release or a stretch in the front of your foot, front of your ankle, front of your foot. Hold this position for 5 minutes. Breathe in and out as you stay in this position.